Your body is always speaking to you, sometimes in whispers, other times in loud cries for help. The real danger starts when we stop listening. We've all been told to be strong, to wait it out, or to think it's probably nothing. And yes, sometimes it is nothing. But what if just once it's something? What if that strange chest pressure you call just gas is your heart pleading for attention? Or that tingling in your arm isn't tiredness? It's the early sign of a stroke? Ignoring symptoms like these can cost you more than comfort. It can cost you your life. Today, more than ever, we're quick to turn to Google or scroll through social media when something feels off. And while there's no harm in being curious, no article or comment thread can replace the trained eyes and hands of a medical professional. Some signs need more than a warm drink and a nap. They need urgent medical attention. Because when your body is sending up red flags, every minute counts. Think back to the last time something didn't feel right. A strange pain, a wave of dizziness, or a moment of confusion. Did you talk yourself out of it? Tell yourself you were just tired, stressed, or overthinking. You're not alone. We've all done it. But here's the truth. Your body knows before you do. It doesn't lie. The key is whether you choose to listen. As we age, these signs become even more important. Our bodies are more vulnerable. Emergencies like heart attacks, strokes, or internal bleeding often arrive quietly. There's no dramatic movie scene, just a strange sensation, a fleeting moment of confusion, a chest that feels heavier than usual. And if you shrug it off, you could miss the window to get help. In this guide, we're going to walk you through 7 warning signs you should never ignore. Not to scare you, but to protect you. Because when it comes to your health, caution isn't weakness, it's wisdom. Knowing these signs could save your life or the life of someone you love. So take a moment. Pay attention. Share this with those close to you. What you learned today could make all the difference tomorrow. And if you find this kind of information helpful, especially as you get older, be sure to subscribe to our YouTube channel. We share clear, simple, and life-saving tips to help you stay informed and in control of your health. Let's begin. The first sign, chest pain or pressure. You might be walking around the house, relaxing with a book, or lying down to sleep when it suddenly strikes. A tightness, a squeezing, a strange pressure in your chest. It may feel sharp or like something heavy is pressing down. Some people say it feels like burning. Others describe it as a dull ache that spreads to the shoulders, arms, neck, jaw, or even the back. Whatever form it takes, don't ignore it. It could be a heart attack. One of the biggest mistakes people make is assuming chest pain is just gas or stress or maybe a pulled muscle, especially if they've never had heart trouble before. But heart attacks don't always look like the dramatic scenes we see on TV. Not everyone clutches their chest and collapses. Some heart attacks feel mild at first. Others come with barely any pain at all, especially in women, older adults, and people with diabetes. Instead of sharp pain, you might feel short of breath, lightheaded, sweaty, or even nauseous. You might just feel off. And that's why any unusual chest discomfort, whether it lasts for 30 seconds or several minutes, should be taken seriously. Even if it fades away, don't ignore it. Get to a hospital right away. The faster you get checked, the more likely doctors can prevent permanent heart damage or even save your life. Because once blood stops flowing to your heart, those heart cells start to die fast. So here's what to remember. If you feel crushing, burning, or tightness in your chest that doesn't go away after a few minutes, call emergency services immediately. Don't wait. Don't try to drive yourself. Don't take a nap hoping it passes. Time is everything. Acting quickly could mean the difference between life and death. The second sign, sudden weakness, slurred speech, or facial drooping. You're going about your day when something strange happens. Maybe your face feels numb or starts to droop on one side. Maybe your words come out slurred or your speech is hard to understand. Or maybe one arm feels weak, like it suddenly won't do what you tell it to do. Even if it only lasts a few minutes, this could be a stroke. A stroke happens when blood flow to part of your brain is blocked or interrupted, either by a clot or a bleed. And when the brain doesn't get the blood it needs, brain cells start to die quickly. That's why every single second matters. There's a simple way to remember the warning signs. FASD. Face drooping. Ask the person to smile. Does one side of the face droop? Arm weakness. Ask them to raise both arms. Does one arm drift downward? speech difficulty. Ask them to repeat a simple sentence. Are the words slurred or strange? Time to call emergency services. If you see any of these signs, don't wait. Strokes can be treated, often reversed, if help is given quickly. But if you delay, the damage can become permanent. Some people lose their ability to speak, walk, or care for themselves, all because they didn't act fast enough. So please, never ignore sudden changes in speech, movement, or coordination. Even if it clears up after a few minutes, go to the emergency room. A quick response could save your brain and your future. The most terrifying thing about a stroke. What makes a stroke so frightening isn't just the damage it causes. It's how quietly it can begin. There's no big warning, no dramatic alarm, just small, strange things that feel like nothing at first. Maybe you drop your coffee cup. Maybe a word won't come out the way you meant. Maybe one side of your face feels different, looks different, or doesn't move like it should. These moments pass quickly. So quickly, in fact, that many people shrug them off. I'm just tired. Maybe I stood up too fast. But these tiny changes can be the first signs of something massive. Something that could leave you unable to speak, move, or even care for yourself. Doctors use a simple rule called FAST to help recognize the signs. F is for face. Is one side drooping when the person smiles? A is for arms. Can both arms be raised or does one drift down? S is for speech. Are the words slurred or hard to understand? T is for time. Don't hesitate. If you notice even one of these signs, it's time to call emergency services right away. Don't drive to the hospital yourself. Let the paramedics come. They can start life-saving treatment before you even get there. And in a stroke, every single second matters. And it's not just the classic signs you need to look out for. A stroke doesn't always show up the same way. It might start with sudden dizziness, vision problems, or a splitting headache that feels like nothing you've ever experienced. It might show up as confusion, trouble walking, or a sense that something just isn't right. And while strokes are more common in older adults, they can strike at any age, especially in people with high blood pressure, diabetes, or a family history of heart disease. The truth is, stroke recovery can be incredibly hard. It can affect your ability to move, speak, remember, and live independently. But if you act fast, you can stop it before the damage spreads. Doctors can use treatments that break up clots, restore blood flow, and protect your brain, but only if you get help quickly. So if you or someone near you suddenly becomes confused, has trouble speaking, loses balance, or can't move one side of the body, do not wait. Don't lie down. Don't try to sleep it off. Call for help immediately. Because in those critical moments, your decision could mean the difference between a full recovery and a life forever changed, or even lost. The third, severe abdominal pain that doesn't go away. Imagine this. You're going about your day when you feel a sudden pain in your stomach, not the normal kind of discomfort after a big meal. This is deeper, sharper, more intense. It might be cramping or stabbing. It might spread across your belly or stay in one spot, like the lower right side. You might also feel sick to your stomach, run a fever, or notice your belly becoming swollen or hard to the touch. These are red flags. Your body is trying to warn you, and you need to listen. The problem with abdominal pain is that we've all had it before, from food, gas, stress, or just indigestion. So we assume the next one will be just as harmless. But not all stomach pain is safe to ignore. Certain types of abdominal pain signal serious conditions, like appendicitis, internal infections, intestinal blockages, or even a ruptured organ. And all of these require urgent medical care. Take appendicitis, for example. It often starts as a dull ache near the belly button, then shifts to the lower right side, and it gets worse fast. If the appendix bursts, it can spread infection through your entire body. The same goes for a perforated bowel or stomach ulcer. What starts as mild pain can become a medical emergency in a matter of hours. In older adults, symptoms can be less obvious. You might not have a fever or vomiting. Instead, you might just feel unusually tired, lightheaded, or off. You might lose your appetite for no reason. Or you might notice blood in your stool or urine. Another sign that something inside needs urgent attention. One of the scariest parts? These conditions can turn deadly quickly. A blocked intestine, for instance, can cause tissue death or lead to sepsis, a dangerous blood infection. That's not something you can treat at home or wait out overnight. And please, don't try to mask the pain with over-the-counter pills and hope it goes away. Painkillers can actually hide important clues and delay the right diagnosis. So here's the bottom line. If your stomach pain is severe, comes with fever, vomiting, dizziness, swelling, or feels wrong, go to the hospital right away. Your abdomen holds some of your most vital organs. And when something in there goes wrong, every minute counts. Listen to your instincts. If the pain feels unlike anything you felt before, it probably is, and it probably needs more than rest. The fourth, sudden dizziness, confusion, or balance issues. You're walking across the room, maybe heading to the kitchen, when suddenly the room tilts. Your knees feel shaky. You're not sure which way is up. Your balance is off. Your thoughts are foggy, and you feel like you might fall. Maybe you try to speak, but the words stumble out, slow or slurred. Maybe you feel like you're floating outside your own body, just for a moment, unsure of what's happening. It's scary, and it should be. These symptoms are your brain's way of telling you something is wrong, very wrong. Your brain might not be getting enough oxygen. And when that happens, you're looking at serious possibilities. A stroke, a brain bleed, or even a brain tumor. Now, to be clear, everyone feels dizzy from time to time. You skip a meal. You stand up too fast. That kind of dizziness usually passes quickly and doesn't come with other symptoms. But when dizziness hits you suddenly, when it's severe, and especially when it comes with slurred speech, confusion, vision problems, or weakness, that's not something you can afford to ignore. One possible cause? A TIA, a transient ischemic attack, also known as a mini-stroke. It happens when blood flow to part of your brain gets blocked for a short time. The symptoms might disappear after a few minutes or hours, but don't be fooled. This is your body sending a final warning. A TIA is often the first step before a major stroke. It's your second chance to take action, and possibly your last. Don't wait to see how you feel. Don't lie down hoping it will pass. Go to the hospital right away. Even if the symptoms go away, your risk is still real. Because when your brain starts to struggle, you don't get time to second guess. You get one chance to act, so take it. Another silent danger: bleeding in the brain. Not all health emergencies come with pain. Some creep in quietly, like internal bleeding in the brain. It can happen after a fall, a bump on the head, or even with no injury at all, especially in people with high blood pressure or those taking blood thinners. At first, the person might seem okay, maybe a little off balance, a little confused, but inside, something terrifying could be happening. Pressure is building in the skull, squeezing the brain. If not treated quickly, it can lead to unconsciousness, coma, or death. Sometimes the symptoms are subtle. So subtle that loved ones don't notice right away. But confusion, sudden memory loss, or clumsiness that seems out of the blue can all be early signs. Even slower growing threats like brain tumors can start this way. A person might seem more forgetful, lose interest in daily tasks, or struggle to follow simple conversations. These changes often get brushed off as just aging. But when they come on suddenly or noticeably worsen, they're not just age. They're a signal, a sign your brain might be in trouble. And remember, your brain controls everything. Your speech, your memory, your ability to walk, think, and feel like you. When your brain starts behaving differently, even in small ways, don't ignore it. If someone you care about starts acting confused, dizzy, unsteady, or not like themselves, don't wait to see if it passes. Don't assume it's nothing. These are loud alarms from one of the most vital organs in your body. This is when you pick up the phone and call for emergency help. Because acting fast might not just protect someone's health. It could save their life. And if you're finding this information helpful, maybe even life-changing, be sure to subscribe to our YouTube channel. We break down serious health topics into simple, clear advice to help you and your loved ones stay safe, informed, and in control. The fifth warning sign: sudden trouble breathing. You're going about your day when it hits you, a sudden tightness in your chest. Breathing feels hard, like you're not getting enough air. You try to take a deep breath, but it's just not working. Maybe you feel panicked, dizzy, sweaty, or like you're going to pass out. You might start coughing or notice your heart racing. And in some cases, you might even cough up blood or feel pain in your legs. This is not something to wait out. This is your body sounding the alarm. One of the most dangerous causes of sudden breathing trouble is a pulmonary embolism, a blood clot that has traveled to your lungs. It cuts off your oxygen supply, and if not treated immediately, can be fatal. The scariest part? It often strikes without warning. People who recently had surgery, spent long hours sitting like on a long car ride or flight, or have heart disease or cancer may not even realize they're at risk. Another possible cause is a severe asthma attack or a COPD flare-up, especially for older adults. You might think, I just need my inhaler, or I'll sit down and rest. But if your breathing doesn't improve quickly, things can go downhill fast. Without enough oxygen, your brain, heart, and other organs begin to shut down. Time is critical. Heart failure is another culprit. When your heart struggles to pump blood properly, fluid can back up into your lungs, making breathing feel like struggle, especially when lying down. Some people wake up in the night, gasping for air, not knowing why. They might feel wiped out, weak, or confused, not realizing it's a failing heart, not just exhaustion. And then there's anaphylaxis, a severe allergic reaction that can close your throat and make it impossible to breathe. This can be triggered by something as simple as a peanut, a bee sting, or a new medication. It can spiral into a full emergency in minutes. Here's the truth. When your breathing changes suddenly, you don't have time to guess. Don't try to push through it. Don't take a nap. Don't wait to see if it gets better. Call for help immediately. Breathing is one of the few things your body must do nonstop. When it struggles, you need to act. Your lungs are sending you a message. Hear it. Respect it. Get help before it's too late. The sixth warning sign: blood in urine or stool. It's something many people see, and then try not to think about. You go to the bathroom and notice something strange. Your urine looks dark, maybe reddish or tea-colored. Or maybe there's blood in your stool, bright red, or dark and sticky like tar. Your first instinct might be to brush it off. Maybe it's something I ate. It'll probably go away. But blood in your body waste is not something to ignore. It could be a warning sign of something serious, something you don't want to catch too late. Let's start with urine. Blood in urine could mean a urinary tract infection, kidney stones, or even something more dangerous like bladder or kidney cancer. The scariest part? It's often painless at first. That's why many people dismiss it. But even a small trace of blood, if it happens more than once, deserves a doctor's attention. Now let's talk about blood in the stool. Yes, it could be from something simple like hemorrhoids or a small tear. But it can also point to internal bleeding, colon polyps, or colorectal cancer, especially if you're over 50 or have a family history. And if the stool looks black and tarry, that usually means the bleeding is higher up in the digestive system, like from an ulcer or bleeding esophagus. That's internal bleeding you can't see until it becomes a crisis. Still, many people don't speak up. They feel embarrassed. But your health is more important than your pride. Blood is your body's way of waving a red flag. It doesn't care about embarrassment. It's trying to save your life. In some cases, internal bleeding also causes fatigue, pale skin, rapid heartbeat, or dizziness. That's your body running low on oxygen and blood. Left untreated, this can cause a dangerous drop in blood pressure, shock, or even death. So don't second-guess yourself. Don't wait to see if it happens again. Don't try to diagnose it yourself with an internet search. If you see blood where it shouldn't be, get it checked now. Early diagnosis often means simpler treatment and a full recovery. But waiting? Waiting can close the window to safe, effective care. When it comes to blood in your waste, trust your gut. If it looks wrong, it probably is wrong. And your best move is to act before it's too late. The seventh. Imagine you're just going about your day, maybe reading the paper, sipping your tea, or chatting with someone, when out of nowhere, a headache hits you. But not like the usual ones you get when you're tired or stressed. This one feels different, sharper, heavier, like something inside your head just snapped or started building pressure fast. It might feel like a sudden explosion in your skull. Some people call it a thunderclap headache. You might feel nauseous, want to close your eyes because light becomes unbearable, or even feel like you're going to faint. If this ever happens to you, don't try to lie down and wait it out. Don't reach for a painkiller and hope it fades. This kind of headache is a giant red flag. It could be something incredibly serious, like a brain aneurysm or internal bleeding in your brain. That's not just scary. That's life-threatening. and it can do permanent damage in just a matter of minutes. This kind of headache is often described as the worst headache of your life. It can be a sign that a blood vessel in your brain has burst, what doctors call a brain hemorrhage. And when blood starts pressing against your brain tissue, it can quickly lead to confusion, vision problems, neck stiffness, seizures, and even unconsciousness. If you or someone around you ever experiences something like this, don't wait. Call emergency services immediately. Time is absolutely critical. There's also another serious condition to be aware of: meningitis. This one also starts with a headache, but it can be followed by fever, trouble focusing, and a stiff neck. It's an infection that affects the brain and spinal cord, and it can spread incredibly fast, especially in people with weaker immune systems. Without fast treatment, it can cause lifelong damage or worse. Now, not every headache is an emergency. Some are caused by things like migraines or tension, and many of those can be managed safely. But if the headache comes on suddenly, feels totally unfamiliar, or is paired with things like vomiting, fainting, blurry speech, or weakness in your limbs, don't ignore it. Don't assume it's just another bad day. These are signs your brain may be in trouble. And when it comes to your brain, minutes matter more than anything. If you're older, even if you've never been a headache person, you should take sudden headaches seriously. At your age, something like this can be connected to high blood pressure or even stroke. If a brand new type of headache appears out of nowhere, that's your body waving a big red flag. So please, if you ever feel a sudden, intense headache that seems off, don't brush it aside. Don't downplay it. Your body is smarter than we sometimes give it credit for. It tries to tell you when something is wrong. And this could be your only warning before something far more dangerous begins. Think of your body as a built-in alarm system. It's always on, always protecting you, always trying to send signals when something is off. But over time, many of us stop listening. We tell ourselves we're just overthinking or that it's probably nothing. But sometimes those small feelings are your body shouting for help. And in those moments, when your chest hurts, when your speech gets fuzzy, when your stomach cramps sharply, or when a sudden headache strikes, the way you respond can mean the difference between full recovery or a long, difficult road ahead. Let's quickly remember the 7 warning signs we've talked about: sudden chest pain, stroke symptoms, severe abdominal pain, dizziness or confusion, trouble breathing, blood in your urine or stool, and now sudden and severe headaches. These aren't little issues. These are loud, flashing warning signals from your body. When they show up, don't wait. Don't tough it out. Don't tell yourself to sleep it off. Go get help immediately. Hospitals aren't just for emergencies. They're places where lives are saved before things spiral out of control. And when it comes to the brain, the heart, or your breathing, seconds matter. Don't give those seconds away to fear or hesitation. Don't let "it's probably nothing" become the biggest regret of your life. So whether you're caring for yourself or someone close to you, carry this truth with you. Your body speaks before it breaks. Listen to it. Trust it. Act on it. It's not weakness to ask for help. It's strength. It's wisdom. And sometimes it's the very thing that saves your life. If this video helped you feel more prepared or informed, consider subscribing to our channel. We make videos like this clear, helpful, and especially for older adults, because your health matters more than ever. Hit that subscribe button and tap the bell icon so you never miss an update. We're here to keep you safe, aware, and one step ahead, because your health deserves your full attention.